Okay, so this is the front door of the Pain Intervention Center on the 3rd floor of Old Metairie Village. To get here, you have to go not through the 2nd floor elevator, but through the inside elevator. You have to enter the door next to the GNC, take the inside elevator up to this 3rd floor, and this is the Pain Intervention Center. So let's go take a look. So this is our waiting room area. And as we move through here, we have Natasha at the front desk and Lacey's in here. So this is our front area or waiting room area. So you enter through the door after checking in. You're in the clinical area. And so this is the main hallway, and the first area you see to the left is the administrative area, and we have exam rooms or intake areas in 5 areas. So the exam room 1, 2, 3, 4, and 5. And you can see a typical exam room. We're able to start IVs, get patients ready for procedures, or see patients for visits in this area. And so as we progress through here, so once a patient's ready and is ready for the procedure, they come into the procedure room. This is the procedure room for the Pain Intervention Center. It's equipped with everything we need in order to perform a wide variety of procedures. We have a variety of needles of different lengths. We have a variety of local anesthetic agents that we would use for any type of interventional pain procedure. We have contrast, which is used to highlight the nerves or document proper needle or cannula placement. This is a C-arm fluoroscope. It's a super C in that it can oblique all the way to the contralateral side. So this provides excellent images, and it's a state-of-the-art system for the treatment for fluoroscopic imaging or X-ray imaging. The patient usually lies on this table, which is a C-arm fluoroscopy table, and while the padding looks like it's dense and full, it's very strong. Radiographic images are permeate this structure so that patient's able to lie on the table and we're able to see bony structures such as in this image. The C-arm table goes right and left and up and down, and that's important to position the patient properly for a procedure. We also generally provide intravenous conscious sedation, so we monitor our patients with blood pressure, continuous blood pressure every 5 minutes. We use EKG monitoring and pulse oximetry, and this is the pulse oximeter probe, so we can measure oxygenation. We have oxygen here, an ambu bag, and all types of resuscitative devices that fortunately we rarely, if ever, use. This is the Neurotherm radiofrequency generator. This is what we use for radiofrequency neurotomies, but we're able to create 3 to 4 lesions at once if we need to. This is the zero gravity lead system. So I'm able to stand in this and not have to wear lead all day, and it's an effective tool for radiation safety. Once the patient has had a procedure, they'll go from this area, and we generally put them on a stretcher, and we go into the recovery area so we can follow through here. We have a small kitchenette so we can provide drinks for patients, Cokes, Diet Coke, Sprites, juice, and we have some snacks because patients have not had anything to eat or drink since midnight, typically before procedure. So we have some crackers and some muffins, and so a lot of people come here just for the muffins. So here's the stretcher, and then we have the recovery bays. And we have 5 recovery bays, so patients recover with a family member in here following the procedure. So each of the bays has its own lighting system, so we can kind of dovetail that, and we have dimmers here, so we can turn it down a little bit and get patients ready to recover and go home. This is the nursing area, so we have we can do administrative work in here, we can do patient records, and we can also keep an eye on all the patients from this nursing area. And finally, we're making a loop and coming back to the administrative area. And we have, we prepare, in the afternoon we see clinic visits, and during the day, so we do a lot of the patient recording, electronic health records here, and insurance approvals and whatever else we need to do. And I think that's it.